they want, and if they feel that quality of their life is getting disturbed because of psychological issues, anxiety, depression, irritability, not getting sleep, getting angry very easily. These are some common symptoms.
Male and female respond very differently to situations. However, men also go through emotions, and these are also tough for them. So I want you to explain, not as a doctor, but as a male, what men can go through in terms of, let's say, infertility journey.
Now see, when we talk about infertility, it is a couple problem.
Yes.
Okay. That a couple is not able to conceive. I won't go into detail of definition and all those things.
Yes, yes.
That a couple is not able to conceive. Now, as we have discussed in the past, that it could be because of male factor, female factor, or combination of the factors. Okay. Now, what will be the response of a male? It depends on many circumstances and many factors, or many variables are there. For example, suppose it is a male factor infertility.
Yes.
Now, see, it affects the self-ego of a male.
Yes.
So he may feel that I'm not a male, I'm not a competent male, I'm not a man. That thing may affect him, number one. Number two, now why is it infertile? Why this infertility is there? Is it just infertility, or it is sexual dysfunction? Now, if it is both infertility, if it is infertility because of sexual dysfunction, it even worsens this belief that I'm not a man. Okay, that can even worsen his psychological health. Then number two, now why other factors which can affect how the male will respond? They are like, how supportive is the wife? What is her take in this whole scenario? What is the take of family members? Like the family member from the girl side or from the boy's side, what are they saying? Then another is the situations around him, that is society. Is he the only person in his known people, that is friends or others, who is not able to conceive, who is infertile couple? Or there are other couples also? Because if there are other couples who are infertile in his circle, then it becomes a bit normal for him. Whereas if he is this is the only couple, then it becomes difficult. This is what I was talking about when male factor infertility is there. Then we can talk about female factor infertility. Here it depends a lot on the psychological makeup of that male. Okay. He may start thinking that, okay, she's not able to conceive, so there is something wrong with her. I should think of other female, I should think of other marriage. So that can even worsen the household scenario. Okay, the dynamics in between the couple, that can worsen his condition. Or sometimes what happens, it even helps in strengthening their bond. Because if it is a female factor infertility, then we can talk about female factor infertility. Here he starts supporting her. It's okay, we will try, and if nothing is happening, it's just leave it. Our life is bigger than this thing. So it can even help them strengthen their bond. It all depends on the dynamics of the couple, as well as the psychological mindedness of the couple. And obviously, the social surroundings, family plays a very big role in this. So either the person may become anxious, depressed, or some sort of substance abuse may come up, or it can develop into a healthy relationship in the couple. It varies from person to person.
Yeah, it's very varied. So here you have some people who might even, get substance abused. And there's another group of people whose relationship might get strengthened.
Yeah.
So it all depends on individuals and on couples.
Yeah.
Yeah. We are talking about how some families can get strengthened and some can just break. And you're giving an example about a couple who came to you and the wife has got depressive symptoms. So we're talking about in India, right? When we talk about mental health, we usually have very negative thought about people going and talking to a specialist.
Yeah.
Do couples come to you with a broad mind, and do you find that more couples are approaching you?
It has increased in last 10 to 12 years, but there are so many variables in that. The educational background of the place where you are working. Okay. And the psychological mindedness of the treating team. Previously, when I was in medical college, okay, there it was more, there we used to get more of the patients referred from OBG department or infertility specialty clinic. Okay. But now I am in private practice. Here the scenario is a bit different. Okay, because patients go to infertility clinics in the private setup just for to have a child. Okay, and there are a lot of other factors they come into place. Economic, financial factors play a very big role. Previously, when I was in medical college, okay, in medical colleges, treatment is quite cheaper or on a very subsidized rate. And so if the couple is coming and they are being told that, okay, you are having psychological problem, you take help, they are willing. And doctors are also willing. But when it comes to private practice and financial things come up, because treatment of, see, IUI is a relatively not so costly thing. IVF is a bit costlier thing.
Yes.
Cost, I'm not sure, I'm not of that field, but around 1 lakh or something more than that.
5 to
So
2
already, already the couples are a bit distressed about financial thing, and then they think, okay, we will have to go there. We will have to move from one place of infertility center to another place. So many factors are there, but yes, I can say that in medical colleges, number of couples, those who are coming for psychological help, they are increasing.
Patient comes, a male patient comes, and I'm sure that you deal with both the male and female partners together.
Yeah.
But if it's a male factor, then how do you go about it? Because I'm sure the methodology will be different.
When it is referred by doctor, that is a gynecologist or a urologist or an endocrinologist, it means they have in most of the cases, they have done the diagnostic things regarding the cause of infertility already.
Yes.
They have referred for psychological help. That is scenario number one. Some of the males, they come directly saying that I'm feeling sad, unhappy, depressive symptoms, anxiety symptoms. On inquiry, it comes up that they are having stressor is infertility. Okay. When it is referred by doctor, that is, now first I will take up the first factor. When the patient has been referred from a person, other physician, and patient is diagnosed to have male infertility, and he has come to us. Now, in that case, what we do is we try to assess whether if someone is diagnosed to have a condition which is going to affect his life, there will be some psychological issue, which is natural. Okay, you can't expect a person is happy after being diagnosed to have male infertility. That is not possible. So whether this sadness or anxiety is clinical or subclinical.
Okay.
Clinical means that I am not able to work throughout the day. Even when I'm doing my job, whatever job I'm doing, I'm not able to focus. Okay. Even in the daytime, when I'm with the people, okay, at that time, back of the mind, I'm just thinking about infertility, its consequences, those things. So whether this sadness or anxiety, if I'm having some physical symptoms because of anxiety, like palpitations, that is heart is beating very fast, tremors, I'm not getting sleep, it means the person is having clinical psychiatric condition, either depression or anxiety. In that case, we start medicines, number one. The person is not having clinical psychiatric condition. It is just like I am worried when I am alone, but when I am busy, I forget those things. I am concerned about the prognosis of the condition, whether it will improve, whether it will not improve, how much money it will cost, whether my infertility is going to affect my relationship with my wife or not, what is she thinking about me. These things are happening, but these things are happening only when I am alone. Okay. Now, in those cases, we go for psychosocial intervention.
Okay.
I said psychosocial because there are two words. Psychological means focusing on the male. Social means focusing on his social surroundings. That is his wife, his family, his treating doctor. Because some of the questions his treating doctor can answer. Quite a person is not having clinical psychiatric condition. It is just like what happened. The patient or the concerned male is so anxious and scared that he feels scared of asking questions to the treating doctor also.
True.
So we encourage them to go to the treating doctor, take appointment, and make a list of questions. Because what happens in anxiety, they forget to ask half of the question, then go back home, then again feel anxious. Make a list of the questions. Tell the treating doctor that I want to ask certain questions. They will answer. Quite often, it is seen that half of their anxiety is gone with that on. Number one. Second, often what happens, the patient or the concerned male is so anxious. Sometime what happens, the male is worried about what will my wife think, whether she will think me as a male or not, whether she will be loyal with me after this or not. What if she leaves me and goes? So see, solution is talk to the wife. Why are you so scared about it? And if you are feeling scared, we encourage the male to get the wife on the next appointment. Then we talk to them. I have never seen a single couple in which the wife has said that I will leave you. Never happens. Okay, it is all in the male's mind that they feel that wife will leave, what will happen. So just a reassurance from the couple or from the wife, it helps the couple. Then we talk to them. Third thing, sometimes what happens, they feel that what will others think? If I go to parties, they will ask something. If I go to, what will my parents think about me? So in that case, we start the patient with basic counseling, psychosocial counseling we start. And most of the patients, they improve. Very few patients, they require medication. And even if they require medication, it is not for a lifelong time. Maybe for a few months, just that is symptoms, they decrease. That is sleep and palpitations, those things they decrease. And then he can continue with the whatever treatment prescribed by the treating physician. Third thing, sometimes what happens, they feel that what will others think. Now I'll come to the second case. When a male has come and he's reporting of depressive symptoms or anxiety symptoms or some substance abuse, and on inquiry it comes up that they are not able to conceive. Okay, then we encourage the male to go for the treatment. Go to the treating endocrinologist or gynecologist, urologist, depending on the history that he is giving. Okay, we ask them to go there, or if there is an infertility clinic in the place wherever the couple is there, they can directly go to the infertility clinic. There usually all these super specialties are there, and they can get itself treated, or whatever management is there, they can go for that.
And then should the couple still want to, they come back to you for additional support?
Yeah, if they want, and if they feel that quality of their life is getting disturbed because of psychological issues, anxiety, depression, irritability, not getting sleep, getting angry very easily. These are some common symptoms.
Yes.
Okay, if they are having these symptoms, that they can come. Sometimes what happens, suppose a male has come on the first visit. We always encourage them to get the wife also, because what happens, even if they have spoken to each other, sometimes male is hesitant in coming for the next follow. Okay. At that time, wife can act as a co-therapist. She can encourage him that, okay, treatment of infertility is a different thing. We can go to the mental health professional, psychiatrist, psychologist, so that we can have a better, because see, prognosis wise, when will they conceive is not very clear.
Yes.
So at least up till then, they can have a better quality of life.
True. And that is where you come in.
Yeah, there's where the role of mental health professional they come in.
Yeah.
Prognosis.
Question is, in the long run, it's great when patients come to a practicing psychologist or a psychiatrist for mental health help. But in the long run, it's not very great if they become dependent on the doctor, right?
Yeah.
So you encourage them to let go?
See, yeah, let me tell you, when we go for counseling, okay, commonly what people think is that counseling is like doctor will give you advice. But that is not counseling. That is psychoeducational advice. That is done only for 1 or 2 sessions, not more than that. If we take up a patient or client for counseling, in that the main thing is the client or patient, we help the patient to understand what is his or her problem. Number one. Let me tell you, when we go for counseling, number two, we help the patient to find a solution to their problem. Then we help them to work on that solution. Now, one word is common in all of these is help. We do not provide solution. Now, if you help them and they are finding the problem, it means you are strengthening their ability to take decisions.
Yes.
But still, sometimes what happens, that dependence do happen. And in psychological term, we say transference. Okay. Number two, we help the patient to find a solution. Now, a good therapist should be able to sense that now a lot of transference is happening, and he should be able to reflect it back during the session to the client that, see, my role is not to be in your life for the rest of your life so that I will be keep on finding solutions. You try on your own. You make mistakes. But if you make mistakes, then you come back. First, you make mistakes. So if a therapist follow these things, then dependence won't happen.
Yes. You mentioned something very interesting. You said during your course of treatment for all these patients, you've never come across a wife who tells the husband that she's going to leave him because of his subfertility issues.
Yeah, just one case in that wife didn't say. Husband told me that wife might leave.
Okay.
I'm not sure about that case. He said that wife said that just one case in 11 or 12 years. In that also, I have not spoken to the wife because the couple never came back again.
Okay.
I will share.
You mentioned something very interesting. You
that
said
case with you. That patient was on treatment for anxiety disorder with me. Okay. He got married. Then for a few months, he was abstinent for the treatment. After a few months, I got a call. That doctor, I got married and I'm having a sexual issue. I said, okay, you come for treatment. He said that actually we have shifted to some other place, so I couldn't come for last 3 months. So I am having sexual problem. Now kindly give me treatment because I am sure that I don't remember the word sure or my something he said that my wife will be going with some other male if she doesn't get pregnant. I said, see, you will have to come to me so that I can talk to your wife. What is the thing? And since you were already on treatment for anxiety disorder, so I don't know whether your wife told or you are perceiving it. So that was the only case where I am not sure. Rest of the cases, whenever the couple comes, wife just says in Hindi, अरे तुम पागल हो क्या, ऐसा थोड़ी होता है, इस चीज के लिए तो नहीं छोड़ूंगा. ठीक है. So it doesn't happen. It is usually, I'm not saying that it cannot happen.
Yes.
Because every human being is different. But I'm just sharing my experience of last 10 or 12 years. Haven't come across any such case. Share that case with you. That patient was on treatment for anxiety disorder with me. Okay. He got married. The problem happens because, see, if because of this infertility issue, the type of relationship between the couple is not good. Type of relationship means they are irritable toward each other, not sharing the good moments with each other. Then this separation and divorce, those things, they come up. The problem happens because, see,
do you also do marriage counseling in the site when these
see, there is not I don't use the word marriage counseling as such, but counseling, yes, I do.
Yes.
In that, different type of clients or patients, they come in. Okay. Again, I'll share my experiences. I'm not saying it is a scientific thing or scientific research. I'm just sharing experiences. Quite commonly, I come across young males who come before marriage with some sexual myths. Okay, just say after a few months, I'm getting married, and they will say that I'm feeling anxiety and those things. And when I ask, why are you feeling anxious? 2 months I'm getting married, and I am fearful that I might not be able to have proper sexual relationship with my wife. Quite commonly, I come across, next question is, why do you feel so? Because when I was in teenage, I had masturbated at that time. So I feel that I will not be able to have sexual relationship. Now here comes the role of counseling. You can say it is premarital counseling, you can give that term, but actually it is basic counseling or psychoeducation. So such cases I have seen, and they do improve with counseling. We avoid giving medications to them because it is a quite common belief or myth in Southeast Asian countries, okay, regarding your ability to have sexual relationship, what are the things that can promote, what are the things that can hamper. There are so many myths. Just if you psychoeducate them properly, most of the clients, they do not come again that I am not able to do. So they are okay.
So there's actually a belief that among male that if you masturbate, then you will not be able to procreate in the future.
Yeah, if you masturbate a lot. Okay. Now, what is the definition of a lot? It varies from person to person.
Yes, yes.
But this belief is very common.
Okay, so that's very new information.
Even in, say, I was just talking about belief, but even if you talk about literature, there is a condition known as Dhat syndrome. Okay. DHAT, Dhat syndrome, in which because of some reason, some seminal discharge happening from the male's genitalia, secondary to which the male starts developing anxiety or depressive symptoms, thinking that I am losing my semen, so I'm losing my strength. So again, this is one of the cultural syndromes quite prevalent in Southeast Asian countries. So there's actually a belief that among male that if you masturbate, then you will not be able, and the only way to manage them is it depends upon the severity. Okay. If again I am saying, see, in psychiatry, we use the word disorder, depressive disorder or anxiety disorder, if the symptoms are to a threshold level that they are affecting person's life, that throughout the day I am bothered about that, even if I try to not think about these things, still those thoughts are not going out of my mind. Cases they improve with psychological help. Right. Cases that's a lot of doubts and questions explained. Dr. Rahul, when we talk about male infertility and mental health, what is the one advice that you want to give both the partners? Well, that's a lot of see, life is much bigger than fertility. Okay. Amen. But what happens, even for male or female, what happens? But what happens? Because of many factors, if a couple is facing the challenge of infertility, they forget other things. They forget about their good moments. They forget about going out. They forget about their hobbies. They forget everything. They are just focused about we are not able to conceive. See, life is okay. Secondary to that, they will develop many thoughts. What will other think? I am not good, whatever. But one advice is that they should think life in a bigger term. Okay. They should take treatment. I'm not saying they should not. But treatment should be just one part of the life. Okay. So for example, suppose I'm getting up in the morning, I should go for my say exercise or gym or yoga, whatever I'm doing. Then I should take breakfast, sit with my wife, have tea, have breakfast, go for job, come back, do whatever course you are doing. For treatment of infertility, you will be going just once in a week or whatever treatment protocol your gynecologist or infertility specialist has given. Just follow that treatment for the time that you are in that infertility clinic. Rest of the life, you should do whatever you are doing. Otherwise, your whole quality of life will get spoiled. Okay, for example, suppose I am getting up in the morning, I should go for my, say, I've seen some couples, those who have taken loan. They don't have money, they take loan and they come for treatment. Now, see, you are adding on to your own stress. And they should ask it very clearly to the treating doctor that what is the success rate. And then they should take a decision. That's how desperate people are to have children. Yeah, and sometimes it's not just the couple, the family members, grandparents, or like their parents. They keep on telling these things. Yeah. I have seen some couples, those who have taken loan. Yeah, some advice. While subfertility treatment can be part of life, it shouldn't consume us. Yeah. But I think that's easier said than done for those going through it. It is easier said. I'm saying it is easier said. We say it very easily, but from the couple's perspective, it is difficult. That's why there comes the role of a mental health professional or a counselor, leave psychiatrist, at least a counselor. Yes. And in lot of good infertility clinic, they have started appointing counselors also.
Yes, yes. Very helpful.
That is a good thing.
Yes. Well, yeah, sound advice. While Dr. Rahul, thank you so much for your time. We, Subak Health Tech, wishes you a very happy weekend.
Thank you.
All right. Talk to you soon.
Thank you.